Welcome to another episode of Teasing Nyumbani. Today we are going to be working out again from home. We said it's a new normal. If you have a stepper in the house, like let's say stairs going up, you could use them. I personally don't have one, so that's why I have a stool. So it's okay for us to improvise given the scenario of whatever you have. I'm going to give us 30 more seconds to get whatever we are going to use and start this new normal. We are going to start with the warm-up. We're going to do 15 times 3. 15 times 3 starting now. 1, 2, 3, go. 1, 1. Okay. 2, 3, 4. Let's go. 5, right. 6, 7, 8, 9. I almost missed a step. 10, 11. I'm already enjoying this. I'm awake now. Oh, good. 13, 14, and 15. Well done. Clap for yourself. At least we're starting to wake up, right? The time starts now. Let's go for the second set. 1, 2, 3, move. Yes, yes. Perfect. Oh, 1. Oh, 2. Oh, 3. 4. 5. 6. 7. All right. 8. 9. Perfect. 10. 11. You're doing well. 12. 13. 14. All right. 15. Well done. What you do is just keep pacing around. It's part of working out and breathing to control your breath, yeah? When you're in control of your breath, you realize you use less energy during your workout, alright? So you want to reduce your panting as much as you possibly can. Let's go for the third set. Let's go for the third set. 1, 2, 3, move. Oh yeah. That's 1. That's 2. That's 3. 4. 5. 6. 7. 8. 9. 10. 11. 12. 13. 14. 15. 16. Oh, we say 15. I'm taking this too far. If you have a stepper or stairs in your house, you could use them. You could use them for just stepping up, stepping down, hold the rail, and squat. That will do. So what do I mean? So if this is your rail and that is your stair, you just go up like that, up like down like that, and hold the rail and squat. Perfect. I hope you understood. Go up like that, go down like that, and squat. Perfect. If you have a step. If your stepper is lower than this, it's okay if that's what you have. Mine is high and I like it high, so I'll use that, right? If you have any other stable surface that you can use, you can go ahead and use it, but that's gonna be our workout for today. So if you have an injury, make sure your stepper is a bit low and make sure you have a place, whether it's a chair, to hold while you're doing the squat. But for the rest of us, basically what we will be doing is this. Let me show you. So we'll go up, down, then we go like that. 1. Perfect. 1, 2, 3, move. 1, 2, 3, 4. You're doing well. 5, 6, 7, 8. Perfect. Now we're going to pivot using this other leg. Alright, meaning it goes up first and it goes down first. 1, 2, 3, move. 9, 2, 3, 4. No, of course. 5, 6, 7, and 8. Your rest time is 30 seconds starting now. Make sure you're controlling your breathing. So breathe in, breathe out. Let's go. 1, 2, 3, 4, 5, 6, 7, 8. So that was an 8, so we're going for the other 8 on this other leg. Let's go. 1, 2, 3, 4, 5, 6, 7, and 8. Well done, well done. You did well. We have another 30 seconds rest time starting now. You're doing well so far. We have one more set of that to go. Feels so good. It feels so good on the legs. It's a killer, right? Breathe in. Perfect. 8 more seconds to go. 3, 2, and definitely time's up. So we're going to do the last set of this starting now. 1, 2, 3, go. 1, 2, 3, 4, Change legs. 1, 2, 3, 4, 5, 6, 7, and last one, 8. Well done, well done. You did well. You did well with that workout. Your rest time starts now. Our time's up, so we're going to do the next workout. Okay, our next workout, we're going to use the water bottle. And if you didn't find a 5 liter, or maybe you have a 10 liter, it's okay to have a 10 liter. You can have a 10 liter, you can have a 5 liter, you can have a 3 liter. All of them will give us the same effect so long as you're able to hold the water bottle and be in this position, okay? And if you're not able to hold any, it's fine, because some people have injuries on their back and they're not able to do this completely just by going, having any weight. It's okay. You can just hold it, hold your hands out straight. You can do that, and go the lowest you can. Come here and assume the positions that we are doing, just using your hands without using anything. If you can't get a water bottle, you can even use a plate, or you can use any small bottle that you have like this. It will still give us a bit of something, but if you have more weight, the better, because you're able to create more resistance. So let's get this going, starting now. So what we are going to do is, we're going to go down there. Make sure your back is up, okay? We're going to go down, standing position, flip it, take it up. That is 1, all right? And make sure you're holding your water bottle in such a way that you do not get an accident from it if it's heavy, all right? So we're going to do 15 times 3, yes, 15 times 3. My water bottle is leaking, so I'll have to carry it upright. All right, let's go. 1, 2, 3, move. There. Then here, up. That's 1. When you go down is 1. That's 1. We come here, up, there, down. 2. Here, up, here, and down, all the way. 3. Let me see if it's leaking. All right, I'm trying to tighten it up. So that's 3. So we go there, here, here, 4, here, here, 5. Good. Let's go. 6, 7. You're doing well. 8, 9, 10, 11, 12, 13, 14, and one more, 15. When we get to 15, you will go down here and hold that for 15 seconds. Okay, if you have an injury and you can't do the hold for 15 seconds, you can just try and hold yourself on a support. And if you can't do that, you can just as well sit and wait for us. After doing that, you've also done something instead of just sitting down, right? Good, so don't stress yourself so much. So we're going to hold for 30 seconds, starting now. until the timer goes off. Today I'm not counting. We better be storing about something, you know. We better be talking about the weather or something. We have to get something to talk about during this period. Maybe we should have a lot of vitamin C, as you saw the data, right? We need a lot of positive energy, a lot of vitamin C, and activity. You need to get active and also to get a lot of positive vibes your way. Oh great, the time's up. Let's go, 1, 2, 3, move. Down, standing position, flip it here, there. When we go down, we count. 1, right. 2, 3, 4, 5, 6, 7, 8, 9. You're doing well. Oh my goodness. 10. Make sure you secure your back. 11. 12. 13. 14. And 15. Good, good, good. Clap for yourself. We are going to our active rest. I don't know who will be talking this time around, but we need to kill 30 seconds starting now. Right? Starting now, we need to kill 30 seconds. You guys better keep those comments coming so that I can read them. I have to be able to kill these 30 seconds. Yeah. Those who are working out from bed, you know, working out from your phones, like your thumb is really working out. Yeah. Yeah, you're missing out on the real thing here. How to start your day. Perfect. Time's up. 1, 2, 3, move. Let's go. That's 1. I said when you go down, that's when we count 1. Right, that's 2. 3. 4. 5. 6. 7. 8. 9. 10. 5 more. You're doing well. 11. You're doing well. 12. 13. 14. And right. 15. You did it. You did it. You did it. But one more thing. We have 30 seconds to kill. Right? 30 seconds to kill. You could as well call someone or just have it out like that. We have 30 seconds to kill on this. Yes, yes. All right. All right, all right, all right, let's go. Hold it. Hold it, hold it, hold it, hold it. You're doing well. Time's up. Well done, well done. So, the next workout we are about to do, just in the next few seconds I'm going to demonstrate, but first of all, let's rest starting now. Let's have a rest time starting now. All right. Rest time starting now, 30 seconds rest time. So, if you have an injury and you want to do this workout with us, this is how you're going to do it, right? So, we're doing basically lunges with a bit of side moves, right? So, you're going to do that, then you do the front one, nicely. So you can even get it to a surface where it can lean, so you lunge, then you come together, lunge, then you do that, then you move again, lunge, then lunge, then again on the side, all right. But if you don't have an injury and you don't need to hold anything, you don't have any balance issue, don't give yourself a balance issue. All right, let's do this. So what we're going to do is lunge, lunge, then you're here. Then when you get to the other side, use the other leg, lunge, lunge, then you move to the other side, okay? So every time we lunge, we're going to count 1. So when we go lunge, that's 1, 2, 3, 4, up to 10, all right? Hold your hands here, let's go, 1, 2, 3, front first, then back, all right? 1, 2, 3, lunge, lunge, then we move to the other end. Now we use this leg. So front first, lunge, and then we lunge back, right? Then we move, that is 2. We move the other side, then we go to the front. You don't go up, don't go up, don't go up, lunge, then we go here and move, right? Right, that's 3. So we go front, there, and then we go there, right? We move, that's 4. We have 6 more, so just keep going. Right, perfect. Then lunge, perfect. Then we keep moving. Oh my goodness, it's starting to burn. That's 5. There, oh, there, all right. Perfect, perfect. That's 6. That's 6. 4 more. You're doing well. You realize the last 2, I'm doing them from behind, right? Good. We have 3 more, right? Lunge, and then lunge, right? Oh goodness, it's burning. We have 2 more. 1, right? Let's go, let's go. You have 1 more, it's burning. There and there. Well done, clap for yourself. I hope you can feel the burn, right? Yes, same here. Our rest time is still 30 seconds, unfortunately. We can't rest for long. We are doing another 10, all right? We are doing another 10. You can land forward, backward. Just make sure you do forward and backward. All right, let's go. 1, 2, 3, go. You're here, lunge, lunge. We move to the other end. Yes, lunge and lunge. That's 2. Then you lunge and lunge. That's 3. Let's go. Don't go up. Don't bend. Torso upright. Torso upright. Yes, that's 4. We are doing well. Lunge and lunge. That's 5. We are halfway there. Don't break it. Don't break it. Right. That's 6. We have 4 more. 4 more. We have 3 more. That and this. Right, let's go. We have 2 more to go. That and that. Right, let's go. Let's go, 1 more to go. That and that. Right, clap for yourself. Set number 2, the burn, the burn, the burn. We are going for the last set of this workout. I can see you. Stop clapping, stop. Oh, well, clap for yourself for doing it, not for us finishing it. All right, let's go. 1, 2, 3, move. Right, we are here. That and this. Right. That and this. Right. Those are 2. That and that. Those are 3. Good. And that. Those are 4. And that. Those are 5. That and that. Those are 6. That and that. You're doing well. Those are 7. Stay upright. Stay upright. That and that. Those are 8. We have 2 more to go. 8. Just stay down. Stay down. Don't go up. No, you don't just walk across. Yeah, just stay down. Right. 1 more. There we go. There and here. Well done. Well done. Well done. You did that. That was amazing, amazing, amazing. And our time's up for today. You did well for today. Clap for yourself, because tomorrow Peter's gonna be here with the moves that I still can't master, and I'm okay with that. My name is Evelyn of Eval Health and Fitness. Keep following. Thank you.
I know that every single one of you are all victims of Salvador del Mundo. Our mission is to get justice. It isn't easy to achieve justice. We will prepare for it, train hard for it, and we need to be very determined in order to succeed in our goals. It is not hatred that will fuel us, but our desire to stop the evilness of Salvador del Mundo.
I stand firm with my principles. I will not allow anyone to shatter all my hopes and dreams for our country.
The Kenya Film Commission, in line with its mandate and function of promoting development of local content and establishing a film fund, has established a film empowerment program that will provide film and video-related funding. Individuals, companies, and organizations will be required to submit funding applications to the Commission. To register, visit www.kenyafilmcommission.com.
Here at NMG, we are working very hard to ensure your favorite publications, Daily Nation, Business Daily, Taifa Leo, and the East African are readily available. In a bid to support the efforts to prevent the transmission of COVID-19, NMG has ensured our staff, our distributors, and their staff adhere to set guidelines. At our printing plant, all staff are required to wash their hands before entering the factory and must be wearing a mask. All workers either change their clothes on entering the factory or wear an overcoat. We are keeping doors open to avoid our staff touching door handles repeatedly. With our automated printing, contact with the newspaper is kept to a minimum, and at the packing process, the staff observe social distancing. Vehicles used to transport the newspapers are disinfected daily before the newspapers are loaded, and our delivery staff all wear masks and wash their hands regularly. Our vendors ensure that they sanitize every time they handle money and wear their masks at all times. NMG is proud to be able to safely meet your information needs. Stay safe, stay informed with our favorite NMG publications.
This is NTV.
Good morning, East Africa, and welcome to your world on this second day of June. Happy new month to you. Now, the right to health is a fundamental human right guaranteed in the Constitution of Kenya. It actually states that every person has a right to the highest attainable standard of health. We have personal stories and experts who will be helping us take stock of if the right to health is still unattainable or attainable in the face of the coronavirus pandemic. And you can join in on that conversation on that hashtag new normal on social media, and you can also text or call with your opinions. Before we get the ball rolling, my name is Gladys Gachanja, and this is what you can expect. Today, we look at your right to access medical care and the aspects that revolve around right to treatment. South African game farmers supply excess meat to hungry people during the lockdown.
The mother of 8 says the condition caused her a lot of pain and agony.
Shame and stigma deprives ladies of their right to treatment. We take a deeper look into this problem. South Koreans get tested and treated again after the virus infected more people. You on the conversation if it is attainable to actually have your right to health despite the conversation going on, which is COVID-19. And our conversation today is around this question of the day: what has been your biggest challenge when trying to get medical care, especially during this COVID season? That question again: what has been your biggest challenge when trying to get medical care, especially during this COVID season? Remember that hashtag new normal. You can call or text in with the numbers at the bottom of your screen, and also you can call in even as we engage experts and hear from personal stories as we go through this COVID season. Now, a look around the world in terms of the effects of COVID-19, and we're looking at the figures. Now, globally, the numbers stand at 6,365,473 people reported to have contracted COVID-19. So far, 2,903,418 have recovered from COVID-19, and unfortunately, 377,404 people have succumbed to COVID-19 globally. Now, a look at how it looks like in Kenya. 80,052 people have been tested this far, according to the government, and 2,000 and 21 of them are confirmed to have the virus, and 69 people unfortunately have succumbed to this disease this far, and 482 people thankfully have recovered from COVID-19 in Kenya. Now, a look at our neighbors in the continent. Tanzania, those numbers still at 509 confirmed cases. Those who have succumbed to the disease, 21 people, and 183 people have recovered from COVID-19 in Tanzania. In Ethiopia, 1,172 people, they are reported to be COVID-19 positive. Deaths stand at 11, and recovered patients so far 209. In Somalia, the confirmed cases stand at 1,976, deaths 78 people, and 348 people have recovered from the same. In South Sudan, 994 people confirmed to have COVID-19. The deaths stand at 10, and the recovered cases in South Sudan are at 6. In Uganda, 534 people confirmed to have COVID-19. Fortunately, no deaths reported in Uganda and 72 recovered cases there. In Rwanda, that number stands at 370 people confirmed to have COVID-19. Unfortunately, one person has succumbed in Rwanda, and 256 people thankfully have recovered from the same. In Burundi, the cases are at 63, one death, COVID death, and 33 people who have recovered from the same. Remember, these are the numbers globally and of course in the continent and closer home. We shall keep our eyes on them and updating you even as we get them. Now, to fight the spread of COVID-19, the Kenyan government is conducting daily mass testing in different neighborhoods of the capital, Nairobi. The tally of infections has doubled since mid-May, but the country has also tripled its number of daily tests from less than 1,000 to nearly 3,000, which has helped unearth more cases. Now, to our neighbors, Tanzanians enjoyed beaches and bars again as they were allowed to reopen, following a coronavirus lockdown. Now, many families in Dar es Salaam, celebrated Eid by visiting one of the city's public beaches.
Uamuzi ambao serikali imeufanya wa kuweza kufungua biashara tena, kwa ujumla kwetu ni faida. Hata si viongozi, kweli hali ilikuwa ni ngumu sana. Kuna baadhi ya management ambao tayari watu waliweza kusimamishwa. Lakini sasa hizo watu wamefurahi, wanafurahi sana. Tunaweza kuipongeza serikali kwa ujumla kwa ushirikiano mkubwa sana ambao inatunga mkono, especially kama sio wafanyabiashara wa sehemu za starehe. Kama serikali inavyozungumza katika vyombo vya habari kwamba ugonjwa bado haujaisha, lakini tayari tunaendelea kuchukua tahadhari kuhakikisha kwamba wahudumu wanakuwa salama na wateja wetu vile vile wanakuwa salama katika Juliana Pabu. Kwa hiyo tahadhari ni muhimu sana. Ndio kushauri hata wenzetu ambao wanafanya biashara kama ya kwetu vile vile waendelee kuchukua tahadhari. Mpaka hapo serikali itakuwa imetuhakikishia kwamba tayari ugonjwa umetoka kabisa.
People now they are going to the employment, they come back, so people they can get their daily income from the companies. We can get our salary, so we are so happy for the government even that they can get the revenue as well. So it is very great.
Now, South Africa's strict lockdown provides a number of challenges for its large immigrant community who have been left with no source of income for weeks. Despite money being set aside for the provision of aid and relief, many of these immigrants will not be recipients due to their status in the country.
And most of the community, like let's say the migrant or the refugee, they could not work. They used to work in a saloon. And some they used to be in the barber shop, some they used to sell food maybe on the corner. But like they're not allowed, they could not easily get the permit. So meaning that they are suffering, they need to beg food from left to right to survive. So it's very, very important for them. I believe that is a great thing because their life also depends about the food and the life of their kids. Yes, I think the South African government is unfair because The foreigners, migrants, they are complaining about the situation that they are not being served, about the food. And so I never seen one of the places they've been served. And I can say that about what we got, but because the record prove, we got the record that is showing that they are receiving nothing and they are complaining, except from some NGO that are assisting them.
But unfortunately, the government of South Africa is far much xenophobic than the local community. We get acceptance from local community, we coexist with them, we live with them, and even today you have seen, we giving even food parcel to them. So we have got no much problem. But it's the government officials, especially the high-ranking government officials, that are actually creating this tension within community.
So we're seeing large amounts of asylum seekers, refugees and migrants who are in really difficult situations because they are unable to access food parcels or special social grants. In addition to this, we do have large numbers of South African citizens who are also undocumented, who are also unable to access relief. So what we really need is a response from government which doesn't differentiate or discriminate against people on the basis of documentation.
Back home, Charles Mwenda, a widower and a father of two, was on Friday forced to spend the night stranded with his wife's remains after what he says was a harrowing experience at the hands of the police. Anita Konge has more on that tragic tale.
It was a journey already full of grief. For Charles Mwenda, a long journey lay ahead of him and his loved ones as they headed from Malindi to Meru County to bury his wife who had died of cancer. In accordance with the law, Charles made sure he got cleared for COVID-19 and acquired all the relevant travel permits before beginning the journey. However, trouble began once he had reached the Meru Tharaka Nithi border.
Meru County ndio nimeambiwa siwezi ingia kwenda kumzika mpendo wangu. Nimekuja, polisi wale walikuwa hapo wakatuambia mpaka mwili ushuke kurudishwe ama turudi ama tushukishe mwili. Mimi na watoto wangu na mama tunafanya nini tukuje tuzike mwili, lakini watoto wangu ni wadogo, hawezi kuja na mama hawezi kuja kwa sababu kulikuwa usiku.
According to Charles, his family and friends were all forced to leave him and return to Malindi.
We did not find it necessary to allow the whole that the 3 people who had traveled from Malindi for the burial. However, we were able to provide transport for the body and facilitate one close relative of the deceased, and we facilitated the transportation of the body to Tigania West.
But, according to Charles, once at the Kianjai police station, the body was offloaded and along with Charles left stranded in the cold rain throughout the night. Charles says he pleaded with the police to at least drop the body at his home, only 5 kilometers from the police post, but they declined.
Tumenyeshewa kutoka hiyo time hiyo nilifika saa 8, nikanyeshewa mpaka saa 12 asubuhi. Ni mvua tu inaninyeshea na niko na mwili. Bibi yangu ako hapa na mimi niko hapa, nikabidi nikae nimwingishe chini ya lori at least. Ile chini ya lori nimwingisha pale katikati karibu na tank kukakajaa maji. Nikavuruta sanduku tena, nikakuja nikaweka hapo nyuma kidogo. Lori yenyewe ndio hiyo maji imejaa kwa hiyo lori. Sinaona lori imefunikiwa, imefunguliwa juu. Nikaingia ile maji ya mvua nikaanza kutumwagia maji tena.
Though he eventually managed to bury his wife, traumatized, he had only one request.
Kitu ambacho naomba isiye katendeka kwa mtu mwingine. Sababu yangu yameisha na nimemzika bibi yangu vizuri, lakini naomba isifanyike kitu kwa mtu mwingine.
Anita Konge, NTV.
Indeed, very unfortunate. Now to some good news. 9-year-old Stephen Wamukote is the youngest recipient of the inaugural Presidential Order of Service Uzalendo Award. Wamukote caught the attention of the nation when he invented a semi-automatic hand washing and soap dispensing machine using locally available materials. The innovation, which he made with the help of his father, seeks to ensure minimum hand contact by its users so as to avoid the spread of the coronavirus disease. State House says this award goes to champions of COVID-19, and NTV caught up with Wamukote at his home just over a month ago and shared his story, and we now honor him by rerunning the story of hope and inspiration.
At the beginning, it was tethered to a tree, this attempt by a young boy to provide homegrown solutions to the COVID-19 disease and its prevention, a clean, accessible hand-washing station.
Tulikuwa tumekaa na yeye tukiwatch TV. Kisha akawa ananiuliza kwamba baba, mbona tusitengenezee kitu yetu yenye tunaweza kuwa tunatumia kunawa mikono ambayo haiwezi kukuswa na mkono na miguu.
A few adjustments here and there, and this family has one of the most effective homemade hand wash stations in the county of Bungoma. This station is hands-free, and with just a press of the foot pedal, a user is able to dispense soap and clean water. The station has a basin and a wastewater disposal system. It is a culmination of a dream and a gift that the young boy has had.
Nichukua mbao za baba na nikatengeneza na nikafika pale nikashinda na baba akanisaidia tukamaliza.
Tuma kwa duka alafu akarudi akaniambia, "Gai, mama wanatangaza kwa radio kuna corona." Alafu watu wamechukua mtungi wanatoboa na msumari. Alafu wananawa, alafu tena mtu mwingine akikuja anashika msumari tena anatoa ananawa tena anarudisha. Sasa hapo hivyo Sibaru tu anashika hiyo magonjwa tena. Sasa akasema si tutatengeneza yetu naita kwa hivyo.
And as they say, the apple doesn't fall far from the tree. Stephen is only following in the steps of his carpenter father. For now, though, he can't do the heavy lifting when it comes to actualizing his ideas, so his father does that for him.
Unajua mtoto akianza kufanya kitu fulani mpaka umpe himizo uangalie venye anaendelea. Mimi ni mtu mimi na survive na talents. Sasa singependa ni uwe mtoto kama amejepuka na talanta fulani yenye inamsaidia katika maisha yake. Huenda maybe hata asifanikiwe kwa elimu venye anatarajia, lakini at least that talent can maybe help him in the future. Inamsaidia, inaweza manipulate na imsaidie kwa njia fulani ama nyingine.
This costs just about 3,000 shillings only, a paltry sum compared to what his county used to acquire jerrycans only for the same purpose. Brenda Wanga, NTV.
Kudos to Mukota. Now, access to healthcare services, especially at this time, can be strenuous due to competing healthcare needs and emergency response. But technology is slowly turning the tide, making healthcare available during the pandemic. And one such innovation, the SAL Medical Health Platform, ensures services are available just on the click of a button.
In Nairobi's Eastleigh Estate, Silas Onchiri, like many Kenyans, has felt the ruthless sting of the high cost of accessing medical care.
I had a problem ya throat. Walikuwa wanitibu na 10,000, lakini wakanikatia discount na 80,000.
Meeting medical fees, prescriptions and the full cost of treatment has been a challenge to a number of Kenyans, especially those who pay out of pocket.
The idea was brought to us after patients who come on cash basis had issues in meeting the full prescription given or seeking all the services that they might require. So we got the idea from SAL Health, from the promoter of SAL Health, which enabled us to be able to give discounts and enable the cash patients that come to be able to meet all the required tests that have been ordered and the drugs that have been prescribed.
Eric Petit, the CEO and founder of Sahal Health Innovation Company, came up with an idea to create a platform to help patients access healthcare at a discounted fee.
Partners being able to give discounts, higher discounts up to even 30. We are getting challenges along that way. Also, some partners coming on board and giving low discounts, like 2-3%, and most of them they want to give 2-3%, and that's why they are even not on the platform.
The Health Innovation Company operates on consumer-driven product development and in partnerships with hospitals and insurance companies to link up and help in availing services at a subsidized fee.
If it's a hospital, they say they are comfortable, let's say, in giving 15% discount to members. And on this, they sign an agreement, then they upload, the partner uploads himself on the system and applies that 15%. That 15% can only be changed if there's another agreement. So by the time a client is going to a partner facility, they already know the discount that particular facility is offering. So the facility chooses which discount they are comfortable with, and it is put on our system.
The All Under One Roof app helps links patients in need of critical care and services during curfew as the country battles the pandemic. Service access is by a click of a button online.
We provided an avenue in which we can be called and pick them and take them to a facility of choice for free. And we have picked several cardiac cases. We have picked maternity, mothers who want to deliver, people who have stroke, and we have taken them to facilities. And those are ways we have tried to help.
In Kenya, it is estimated that 3 out of 4 Kenyans risk falling below the poverty line due to direct out-of-pocket payment of medical bills. Eunice Omolo, NTV.
Great initiatives there coming through even as we go through the COVID-19 season. And the core conversation, as I'd mentioned earlier today, is about the right to health. And the objective of this conversation is to ensure that your right to health is respected, protected, and actually fulfilled despite the pandemic and all that's going on at this time. And to help us have this conversation with me in studio, Alan Maleche, Executive Director at Kalin. Thank you for joining us. We have Angela Ngoko in there, the studio executive director at the Y Ribbon Alliance Kenya. We have Eric Okioma, who is a community health advocate in Kisumu County. Thank you for joining us. We also have Vidalis Njoki, who is deaf and dumb, but she is here with us and has an interpreter who is Flora Atieno, who will be joining us throughout this broadcast. And of course, in our Mombasa bureau, we are joined by Hazel Koitaba, who is the CEC in charge of health. Thank you all for joining me on this really vital conversation. So, Alan, we have just said, according to the Constitution, the right to health is stated to every Kenyan is accountable and should get the highest attainable standards of health. What exactly does that mean?
I think the right to health is well articulated in our Constitution, and in a layman's language and not going very legalistic, the right to health means basically people should be at the center of the response for health and not around the disease. So you must understand what are the needs of the people, what do they need for them to be able to access better health care, and you program around the needs of the people and not around the needs of the disease, as we've seen with COVID. So you must ensure the right to health then means that people can have health facilities that are accessible, that are close to them. The facilities should be available, there should be many. The services given should be of good quality and should be services that are accepted according to medical standards. That's basically what the Constitution aspires, whether there's a pandemic or no pandemic, the right to health remains central. And I recently argued, together with the Special Rapporteur for Health, that the right to health must be central, and you must not look at the right to health only from the medical perspective. There are social determinants of health. If you don't have clean water, if you don't have food, if you don't have good housing, if you don't have social protection, then it'll be difficult for you to enjoy the right to health. And so the mistake we have made over and over when we have pandemics or diseases, we take a medical approach and forget the other things. And this is what exactly we've seen with the COVID response, that we began by dealing with the medical perspective and factoring in the social other perspective or the determinants of health much later on. And that's where the challenge lays, because if you don't address the social determinants, you cannot then reach the goal of meeting the right to health. And that is how any person working within the health sector must think when they are framing an intervention, whether for a pandemic, whether for a single disease, whether it's providing UHC. Have I thought about the right to health from that perspective?
Well said, and I think it sets a very good overview of what our conversation will be about today. So let's break it down and bring in Angela Ngoko. Now, your work at the Alliance Ribbon of Kenya is something that has to do with maternal health care. How are we faring on in as far as that is concerned within this pandemic?
Thank you so much, Gladys. I would start by saying that I don't think we started by faring on well. I don't think even we thought about maternal health, even in the midst of pandemics. There's something that I keep on saying, that pregnancies don't stop with pandemics, or women are still getting pregnant, women are still giving birth, children are still being born. And at the end of the day, within the COVID response, that should have been taken into consideration. We saw from the word go that even with when the measures were being taken by the government, the lockdown, the curfews, even the way the reorganization of the healthcare services in the health facilities was done, I think there was the thought that that would have stopped, women would have stopped giving birth, or women were not getting pregnant, or children were not being immunized or being born and the like. And that's why you saw a lot of times people are not able to access health facilities during the curfew hours. And there was a lot of outcry with a lot of many of the women starting to give birth at home because they were afraid. The border riders, of course, could not go to the health facility at night because they were fearing the police response and the like. And so I think, for me, I feel like the response did not take, as Alan said, took a medical approach, blocked out other essential health services that were already going on even without the COVID in our midst, and that is one oversight that should not have been done and should not be repeated in this country. Why? Because the gains that have been made in the maternal health space are being watered as we speak now. More mothers are afraid to go to health facilities because of myths and misconceptions. Of course, health literacy should have taken a fast even before the response was done by the government. There should have been also a multi-sectoral response, such that even the local administration were aware that there were other exclusions and diseases. People are still getting sick, mothers were still going to deliver in health facilities, and children are still being immunized. And there are so many things that happen even during the lockdowns and the like. So I feel a multi-sectoral response would have taken a fast, even before we went to the medical response. Yes, I acknowledge that we're in an emergency, and during an emergency, some things can be overlooked, but you cannot overlook the essential healthcare services. And you cannot overlook that society will still continue being society. And then things which were going on in the normal life were still going on. So that is something that should not be overlooked should we have something else in the future.
And speaking about maternal health, the world celebrates the International Day to End Obstetric Fistula every May. And in Narrow County, a clinic that was started in November 2019 has brought hope to hundreds of mothers who have been suffering from fistula, a condition caused by prolonged labor, which leads to leaking of urine. The stigma associated with this brings about stigma that sometimes leads to the victim denying themselves access to medical help due to the shame. NTV's Rose Wangoi was in Narrow County and filed the following report.
At the Narrow County Referral Hospital, Evelyn Shani was receiving a special gift, a surgery that would free her from obstetric fistula. That surgery, amongst many, conducted on the International Day to End Obstetric Fistula. For close to a decade, Evelyn has been living with fistula before she decided to seek treatment. She tells us that life had been nothing but misery.
Kaka nikazaa watoto ngapi? 2. Ya 3 mkojo sasa inaanza kutiririka. Lakini watu walikuwa wananicheka sana. Uwe ni mimi nilikuwa ninaenda kanisa, lakini mimi sikustuka.
Obstetric fistula is a hole between the birth canal and bladder or rectum that is usually caused by prolonged or obstructed labor. Women who suffer from fistula end up leaking urine uncontrollably, ashamed and stigmatized. The mother of 8 says the condition caused her a lot of pain and agony.
Kitembea mahali watu wanasema hii ni nini? Hata gari ukiingia ni shida.
Evelyn was operated on successfully. The smile on her face was enough to express her joy. She's now waiting to go home clean and dry. Having lived with fistula for a decade, Jane Manangoi understands the pain, suffering and shame that victims and survivors alike battle with every single day.
Kuna wale wanakucheka, wanafanya nini? Nilipitia hayo yote. Hata kanisa nilikuwa naenda, ninasikia kama ninasumbua wale tuko na wao. Saa zingine ninatoka nje, mimi nasikia neno nikiwa nje.
After living with fistula for over 10 years, Jane was operated on successfully 4 months ago. Most women who suffer from fistula often live like a shadow, ostracized by their family and community.
Now, speaking about fistula, and which is a complication of delayed labor or even having a child at home without the proper assistance, let me bring in Eric Okioma, who is a community health advocate in Kisumu. You live in an informal settlement. How does it look like for mothers right now during the pandemic?
Actually, I think mothers are having a big challenge, particularly expectant mothers. We had a case of some someone who could not access an ambulance just the other day, and it took about 5 hours for that person to be reached. And looking at it, we are in a county that has faced a lot of challenges. Looking at we had the doctor strikes, we had the floods, and now we have COVID. And you realize some of those have really brought a lot of challenges in terms of people accessing care in Kisumu.
Now, Eric, when you say a mother had to wait for 5 hours for an ambulance, what was the issue exactly? Why the delay?
Just getting lost. I'm not getting you.
Okay, I'm asking, you said the mother had to wait for 5 hours before getting emergency assistance. Why the delay?
Actually, what happened is that there were no ambulances. There was an ambulance at the hospital, but there was no fuel. And looking at, when you look at COVID, in terms of COVID, if it was a COVID issue, you could see sirens rushing to the place and to pick the person. But now, since it was a mother and all those kind of things, you could find out that things were not working. These are systems that are there. They're just there on paper, but in terms of functionality, is a big problem. I think our leaders only issue statements that everything is good, but otherwise things are not working as they should be. There's no seamless, there's no synchronization of services whereby things are able to work out the way they should be. And I think those are just some of the few cases in some of the, that's a tip of the iceberg. But otherwise, you'll realize that going even to a facility is also becoming a problem because of even people going there. For example, somebody taking your temperature, the fear of going to quarantine, and quite a number of issues that have come. Looking at quarantine also, when you look at it, it's looked as if you're going to be arrested, because the approach of the Ministry of Health is more persecutive than rehabilitative, because most of the people you'll see policemen, you'll see all those kind of things, and a lot of things just in our communities which are becoming more, accessing healthcare is becoming more difficult. And again, you'll realize that as much as when we look at our communities, for example, like the mother that you're talking about, if you're looking at our midwives and all those kind of things, the traditional birth attendants, there's a possibility that people might go back there. And yet people are being told that you have to go to the mothers have to go to the clinics and all those kind of things. And I think it's important if things should actually work as they say. But I think that is not the case, because looking at what happens around our community, there are quite a number of issues because of particularly now around the COVID pandemic, and we might lose a lot of gains that we've made in terms of our healthcare, in terms of the mothers, in terms of TB, in terms of HIV. It's a big problem. I think the post-COVID.
Eric, at this point, let me stop you at that point. We shall touch on some of those issues you're bringing up and come back to Alan. This is what you were referencing to, giving priority to the pandemic vis-a-vis those that need healthcare, right?
Yes, Gladys, I think the issues raised by Angela and Eric are not unique to Kisumu or Nairobi County. There are a number of challenges where when COVID came, we stopped thinking about everything else and we now focused our messaging, our information around COVID. We were told to stay home, we were told to wash hands, we were told to keep physical distancing, and we were made to believe that within healthcare facilities, those who are going there were the ones who had COVID. So for instance, many people that we work with get their treatment for TB from Mbagathi, but because Mbagathi is classified as a place where they hold people in isolation, many people had not found arrangements where they could either get their ARVs or their TB medication. And now that you're staying at home and add down to the lockdown, coupled with the violence that has been emitted by the police force, made it very difficult for people to go on their daily ways of accessing healthcare services. And as Angela rightfully said, this involved pregnant women, this involved persons with disability, this involved mothers who had infants that need immunization. You and I know immunization is critical.
Yes.
You miss one vaccine and that could ruin a child's life. And also noting that our constitution says that the right to health for children is immediate. So I think the concern here and what the ministry is trying to do now is trying to realize, oops, we made a mistake by emphasizing on COVID. How do we get people to start thinking that it's okay to come to the healthcare facilities? And again, the messaging made healthcare workers to be stigmatized because everyone believed anyone who steps in a hospital, be it a nurse, a doctor, the person who cleans, the guard, is exposed to COVID. And even when you go back home and you're a healthcare worker, people give you that look like, are you the one who's bringing COVID in the community? So I think the point here is to say, what do we do? How do we move forward in having a multisectoral response? How do we ensure that other elements of accessing healthcare services, other elements of the right to health are not lost because we are focusing on COVID-19? And most importantly, the resources that are coming in for COVID-19, how best do counties and the national government utilize them to strengthen the healthcare system?
I like the fact that you touched on the county and the national government. We have representation from the county, to be specific, Mombasa County. Hazel Koitaba, you've had the concerns that have been put on the table in as far as access to healthcare and the fear of going to hospital. How are you countering that in Mombasa County?
Good morning, Gladys. In Mombasa County, at the start of the second term of devolution, we were able to put together a health sector strategic and investment plan for the years 2018 through to 2022. So what this essentially did was ensure that we were able to strengthen our healthcare systems, mostly at the grassroots level. And we also concentrated on strengthening our referral systems so that we were not congesting the one and only referral hospital that we have in the Coast region, which is Coast General Teaching and Referral Hospital. So basically, we have been able to strengthen the healthcare facilities at the sub-county levels by ensuring that we have enough commodities. We have improved the infrastructure in those in hospitals. We have ensured also that we have enough healthcare workers so that whoever needs to access those hospitals can access quality and affordable healthcare. At the moment, the residents of Mombasa County, at least 75% of them can access a healthcare facility within a 5-kilometer radius of where they live. So this essentially means that they do not have to use too much money to access healthcare. We have also ensured that for our mothers, they do not have to come all the way to the referral hospital for deliveries. For instance, in Likoni, we have a maternity hospital which delivers up to 30 to 40 deliveries a day. So we have been able to strengthen our healthcare systems, and this has ensured that even in the time of COVID, our mothers and anyone who needs to access healthcare has been able to comfortably do so.
Hazel, we're talking about a county that had several medical workers actually test COVID-19 positive. How has that been taken, and how are you ensuring to get the right messaging to those that are accessing healthcare that they are not at risk?
In Mombasa County, we have emphasized on testing our healthcare workers. Of course, we know that they are at a high-risk level because they are the first point of contact for all those people who may suspect that they have COVID-19. So to date, we've tested 906 healthcare workers, not only in the public sector, but also in the private sector. And we do this routinely. So to date, we've had 28 healthcare workers who've tested positive, but over 60% of those have been able to fully recover. So this has given us a lot of confidence in the fact that, one, much as a few of the healthcare workers may be exposed, there's also the chances of recovering at a faster rate.
Okay, now speaking of those living with a disability, we are joined by Vitalis Njoki in the other studio, who is deaf and dumb. But now, Vitalis, how has been the experience of accessing healthcare at this time and living with a disability?
The experience that I've had has been it has been very difficult, because, for example, during this pandemic, remember, for example, as a deaf person, I cannot go to the hospital alone because I need to go to the hospital with a sign language interpreter. But remember, there's no sign language interpreter, and you don't feel comfortable going to the hospital alone. And sometimes you have a neighbor at home, so you don't know if the neighbor is positive, will help me in signing. So sometimes it becomes challenging. So we see that as a deaf person, we don't get the full information because we don't access healthcare. And also, it's the same everywhere. Sometimes having that, the ban is there, so it becomes so difficult, and staying at home, you feel you're not comfortable. We have some people, some deaf people, and others who have disability. Most of us have lost jobs, so the life has become so difficult. So you can imagine if our peer who are not working are finding it difficult. So you can imagine for a deaf person or a person with disability, it's double tragedy.
Okay, and are you saying when you go to these health facilities, there is never somebody specialized or given that role to interpret or assist those with disability?
No. We don't have anyone. I've never seen anyone in the hospital who knows sign language.
Okay.
Whether you're going to the supermarket or whether you're going to the healthcare facility, you know, sometimes they'll just bring the gadget testing your temperature, but you don't know, they don't even explain why they're doing that. So yeah, sometimes we don't feel comfortable.
Okay, now, Anjali, you've had her concerns. How does that look like, and especially for those that are vulnerable trying to seek healthcare at this time?
Thank you, Gladys. I think it's not just at this time. We are living in a society where we assume all of us fall within the normal curve. That there are those, all of us are okay. When you go to the health facility, we can talk, we can be able to even just walk in the on the stairs and the like. And I'm saying this with a lot of pain in it, because having seen and having working with women especially, and women who are pregnant, they are deaf, they are dumb, they are physically, differently able and the like. And you go to a health facility, and I've seen this in, I think, now 3 or 4 counties during our usual routine work. And you reach that health facility as a woman who is expectant. You have a wheelchair, for example. Maybe you are privileged to have a wheelchair. And Gladys, you cannot even access that facility because there are stairs, and there's no ramp for you to be able to utilize it. Even when you are going to the delivery room, there's no delivery bed for that woman who is in that state. Even when you go to the facility, even the toilets, they are not designed in a way they can be able to cater for that woman. And I mean, sometimes it gets me thinking, for how long will we see this continue? Even outside the pandemic, this is something that is, the people who are differently abled suffer a lot in our society, and we are silent because most of us who make decisions in the different places, whether at the county or at the government levels, even in the private sector, are never cognizant of the fact that not all of us have all the abilities, or we are privileged enough to have the abilities that we have. And this is something that needs to be looked into. Now imagine thinking about that in our normal setup. We are in the abnormal setup of COVID. How does that look like? You go to a health facility, there's no interpreter for you. You go to a health facility, you are pregnant, you are looked at by even the health workers because they are not trained. Sometimes I don't blame them. Like, why are you even getting pregnant and you are disabled? I mean, there are things that I've heard from physically abled, differently abled women and girls, and it keeps me wondering, are they not supposed to be normal people in the society? And for how long will we keep on looking at this way? So for me, I feel like it's the high time now for us to start incorporating that, even if we are going to really fight this disease, all of us, and even when we are going forward to achieve universal health coverage as a country, I feel it's the high time we recognize that there are other people who are differently abled, and doesn't mean that they do not have their needs and their reproductive health needs are still there, their health needs are still there, their education needs are still there. This is something that should be taken into consideration, and quite fast, because I think these are societal, parts of members of the society who have suffered for quite a long time.
Hazel, this is something that is very wanting in so many parts of the country. In Mombasa County, do you have interpreters or people who assist those living with disability, even in quarantine areas?
Yes, in Mombasa County, first of all, we have a Disabilities Act, which ensures that every person who's living with a disability in Mombasa County gets the assistance they need. We support them to get NHIF cover if necessary. And then also at our main referral hospital, we have an interpreter for those who may need that kind of support. For most of our buildings, of course, there's accessibility if one is on a wheelchair. And we have been able to ensure that people living with disabilities get the same quality care that anybody else in the county would.
Hazel, when it comes to the messaging, we're seeing a lot of it on television, we're seeing it on the papers. As a county, are you specializing messages for those living with disability?
Gladys, yes. As a county, we have, as I said, we have a Disability Act within the county, which ensures that we give equal access to the people living with disabilities in the county. So we have been able to prioritize the people living with disabilities and to ensure that they are able to get the necessary support, whether it's through messaging and whether it's through actual assistance.
Okay, and when it comes to the quarantine areas, has this also been looked at?
Gladys, with our quarantine areas, we have done a lot. First of all, for people with disabilities, and also, secondly, we've also looked at the population who may need mental health support. For instance, we have set up a quarantine facility for those who have mental health needs. And at the moment, we have a specialized or separate quarantine facility for them. So far, we have 30 of those people who are out on the streets because of mental issues. And we have been able to treat them and give them the medication they need. And so far, we have found that out of the 30, 2 of them were found to have contracted COVID. So again, we are able to offer specialized care because we realize that they may not be able to go into a regular quarantine facility. So it was important for us to have a specialized quarantine facility for them.
Okay, that is impressive. Over to Kisumu. Eric, when you look around, those with disability, are they catered for, or are they still trying to struggle through all the information and the changes that come with the pandemic?
Actually, what I can say, I don't think there's anything like that, because when you look at it, when you look at how COVID-19 pandemic strategy has been implemented, you'll realize that there's no that aspect of community face. The people are affected, or these patient groups, or people with disability and all those kind of things, you will find that none of them really have information on how they should really go about it. And they might not even know where to go. And even the state of those quarantine facilities, will realize that none of those people, none of the people that I've mentioned have been there or involved even when they were being put up. And we might, probably communities or affected people might not even know how they even look like. So, I think those are some of the major challenges that are there, because when there is no information, you cannot know what goes on.
Now, Eric, earlier you had mentioned on the fact that we are watering down the milestones we've made in catering for treatment for such things like HIV and TB. Are people being able to access medication at this time, or are they scared to go to health facilities?
Right now, what we can say that we still, probably because earlier people had been given medication to take them 2-3 months. But now, as we move towards the next few months, when most of us will be flocking back to the facilities, that is what we don't know what will happen. Because when people go to a facility and mass, and now coming back, let's say after 3 or 6 months, you can imagine the volume of people who will be flocking at facilities and the issues that they have, and looking at the kind of stigma around the issues. We have issues of around stigma. We have other issues like issues around food. Like now, for example, I can talk about people living with HIV. Some of them are living taking drugs because they don't have food. There are other predisposing factors that are really going to come in and are setting in. So those are, for now, we cannot say that because most of them have medication, but going back, when we'll be going back is what we don't know, because we really don't have clear information on how we will go about that.
Okay, now Hazel, most of those who die or have died so far in Mombasa have been reported to be elderly and have underlying medical conditions such as diabetes, hypertension. Mombasa has a burden for cardiovascular conditions. How are you ensuring to cater for these, even as you also look into COVID-19?
As I'd mentioned before, Mombasa County started working on a decongestion strategy, which was to strengthen the main referral hospital, the Coast General Teaching and Referral Hospital. What this essentially did was to ensure that we were able to strengthen our specialized healthcare services at the main referral hospital, while at the same time decongesting the hospital so that those residents who needed to access healthcare for minor ailments such as flus or diarrhea did not necessarily have to come to the main referral hospital for that. They could now go into the sub-county hospitals. We have used a hub and spoke model, which means essentially that Coast General continues to remain the hub for all our specialized care. And at the same time, at the sub-county levels, we have outreach centers, which are actually named Coast General Hospital Outreach Centers. So what this has done is that we've been able to offer specialized services at the sub-county level. And for those people who need to access the main hospital because they have more complicated diseases, they are able to do so without having to worry about congestion at the main hospital. So at Coast General Teaching and Referral Hospital, we have specialists who work at the hospital full-time, and actually for the whole of the Coast region, if anyone needed to be referred for cardiovascular diseases or cancer care or even diabetes, we have those specialists who are able to attend to our residents.
Hazel, there is a question here. Why are people, from the experience now that you're on the ground, why are people dying at home?
Basically, Mombasa County has had 32 deaths which have come about because of COVID. To date, as at yesterday, we have about 563 positive cases. And what we found is that at the beginning, when COVID came, or when we first heard of COVID in the country, there was probably a lot of fear. So anyone who felt they may have contracted COVID may not have been confident to seek medical care and would have probably suffered in silence. So we found that we had to do a lot of risk communication to ensure that people were confident were reassured that if you got COVID, it wasn't a death sentence. You could still be taken in for treatment through our isolation facilities, and you could come out of it. So there was maybe a bit of fear, and I don't think it's for Mombasa alone. I think it was countrywide. But that is something that we have worked on actively. And for the last week or so, if you look at the number of deaths that have happened or occurred in Mombasa, they haven't been as many as when we had our first case of COVID in March.
Hazel, before we let you go, a quick one. We had a story of a woman who was cooking stones for her children because she had gotten to her end in as far as providing for them is concerned. Just an example of some of the hardships that many are going through. Are you still catering for the vulnerable in that county?
Yes, Gladys, we are catering for the vulnerable. It was unfortunate, that incident was very unfortunate, but I think as you've heard, the county government has been able to take up the needs of the lady's family, and as it stands as of today, she's also getting support to build a new house and be able to put up some rental facilities. And this was a unique case, but when we look at our food distribution program, we have been able to continue to fend for those who cannot afford to provide for themselves in terms of putting food on the table. So we have continued to go out and distribute food as county government, and at the same time we have continued to engage the youth of this country or this county to make sure that at least they're coming out and doing something, like we're using the youth to distribute the food, and in turn they're able to get some sort of stipend which will assist them in being able to put food on the table. So yes, we are looking after these vulnerable groups, and we are committed to ensuring that everybody who lives in Mombasa County has a dignified care.
Okay, Hazel, before you go, Alan has a question for you.
It's actually a request, Hazel. I'm really happy to hear the efforts by the county government of Mombasa. And my request to you would be, once COVID has settled, would the county be open to have an audit with multi-sectoral people or different stakeholders to actually see what can we learn from Mombasa County on making services available, acceptable, of good quality, and also accessible to people, because the information you provide this morning is actually the real picture that needs to happen in many counties. So my request to you is that when the dust settles on COVID, would you be open to a partnership with civil society, other stakeholders, including persons with disability, for us to have an audit or an assessment, and even working with technical partners like WHO to see what lessons can we learn from Mombasa County around working around the essential elements of the right to health.
Thank you, Alan. Actually, all along since we got the first case of COVID in March, we have continued to engage both the private sector and the development partners. We've also worked with the CSOs to ensure that we are able to reach every person who lives in Mombasa County. As you understand, the dynamics in this county are different. The people living, for instance, in Vita will not require the same approach as those living, say, in Mwakirunge. So we have continued to engage development partners. We are open for an audit. I mean, everything we do as per the law is transparent. So you're welcome to come to Mombasa anytime.
Thank you.
Thank you. Hazel Koitaba, who is the CEC in charge of health in Mombasa County. Thank you for joining us. I know you have a very long, busy day ahead of you, even as the Ministry of Health and the Ministry of Interior pays a visit to your county. All the best and stay safe. At this point, we take a short break on Your World. We'll be back even as we continue to discuss the right to health. We're talking about availability, accessibility, affordability, and acceptability of the same. Is this the real case? Even as you seek healthcare, that question will be answered right after this break.
we care. For 26 years, we have been advocating for health rights with you and for you. We are determined to keep at it. Coronavirus is a global pandemic that poses significant threat to public health and tests the resilience of our health system. While implementing the public health and emergency measure, we encourage government to pay attention to human rights and principles around transparency, accountability, and respect to rule of law. We remain committed to working with government and other stakeholders in guaranteeing a rights-based response to COVID-19. Kellen, reclaiming rights, rebuilding lives.
This is Fact Finder from the BBC.
The international media has been very critical. The argument is that Botswana tourism makes so much money for the economy.
How has the media covered the controversy on elephant hunting in Botswana? We find out.
How can a community live with these animals despite of the challenges they are bringing?
We speak to an elephant expert on the role of media in conservation.
I'm Fatia Noor at the Safaricom Innovation Center in Nairobi. I'm talking to a couple of young innovators here who have developed tools for fighting fake news.
Here at NMG, we are working very hard to ensure your favorite publications, Daily Nation, Business Daily, Taifa Leo, and the East African are readily available. In a bid to support the efforts to prevent the transmission of COVID-19, NMG has ensured our staff, our distributors, and their staff adhere to set guidelines. At our printing plant, all staff are required to wash their hands before entering the factory and must be wearing a mask. All workers either change their clothes on entering the factory or wear an overcoat. We are keeping doors open to avoid our staff touching door handles repeatedly. With our automated printing, contact with the newspaper is kept to a minimum, and at the packing process, the staff observe social distancing. Vehicles used to transport the newspapers are disinfected daily before the newspapers are loaded, and our delivery staff all wear masks and wash their hands regularly. Our vendors ensure that they sanitize every time they handle money and wear their masks at all times. NMG is proud to be able to safely meet your information needs. Stay safe, stay informed with our favorite NMG publications.
I know that every single one of you are all victims of Salvador del Mundo. Our mission is to get justice. It isn't easy to achieve justice. We will prepare for it, train hard for it, and we need to be very determined in order to succeed in our goals. It is not hatred that will fuel us, but our desire to stop the evilness of Salvador del Mundo.
I stand firm with my principles. I will not allow anyone to shatter all my hopes and dreams for our country.
Good morning, East Africa. Gladys Gachanja here on Your World. Thank you for joining us on this broadcast, even as we have a conversation on the right to health during this COVID-19 season, and actually just even beyond this, we are taking stock of the same. I have so much feedback coming from you, even as we answer that question of the day. What has been your biggest challenge when trying to get medical care, especially during this COVID season? Now, let's look at some of those. We have Wayne Nancy, who says, taking a patient to hospital during curfew time. Yes, that has been alluded to by many. Leamo says, fear of taking my kids to hospital, not knowing who the doctor in charge has touched or come across. Yes, that is a valid concern. Wiki Kuraski says, none. I self-medicate into contact with. Self-medication is a challenge in itself. All the doctors will tell you that. Benwange Teach says, we are afraid of going to hospital now. Fears of contracting COVID because there is high chances of the same. All right. And another from GM who says, God is looking upon us. We are not sick. Amen to that. And we hope you and pray you stay well. Samuel Gisharu says, I haven't fallen ill and I pray that the challenge persists. Amen, or rather does not persist. Amen. And then Kaisa Sharon says, means of transportation here in Uganda. Thank you for joining us from Uganda. And we have Honorable Davis who says the medics approach nowadays is shocking. Rudeness, especially when you're intending to use NHIF. You can be ignored for up to 6 hours on the bench or forever until you avail cash. Interesting perspective there, and we shall be looking at more of your feedback even as you answer that question. What has been your challenge accessing medical care during this time of COVID-19? Now, to have this conversation with me still in studio, Alan Malecha, who is the executive director at Kelin. We have Angela Ngoko, who is the executive director at the White Ribbon Alliance, Kenya. We have Eric Okioma joining us from Kisumu. He is a community health advocate. Here in studio, Videlis Njoki, who is deaf, and Flora Atieno, who is our sign language interpreter for the broadcast. And of course, we are joined by Andrew Mulwa, who is the CEC in charge of health in Makueni County. Thank you for staying with me, and for you, Andrew, joining us this morning. And I'll start with you, Alan. We have had challenges even coming from some of the feedback that's coming through, being afraid of going into the health facilities. What should be the ideal situation to ensure that people have the right information about COVID-19?
I think what should be, Angela, I think what should be the ideal, Gladys, what should be the ideal situation should be that we need to rework our messaging. As I mentioned earlier, we need to ensure that we tailor our messaging to the needs of people. How have we tailored messages for Njoki's community? How have we tailored messages for children? I have not seen any health official have a special address for children who are at home about COVID. How do we tailor that message, and how do we get it out of the minds of people that it's safe to seek healthcare services when you need to be able to do so, be it an emergency or be it routine medical care that you need, especially if you have children who are being vaccinated. So the key point becomes, can the Ministry of Health, can other counties work with behavioral people who help change behavior or messaging that will get us out of where we've been or where we are now, where we know step out during curfew, just stay at home and be strong because you do not want to face the wrath of the police. Whether you're going to bury your loved one as Charles was doing, whether you're going to vaccinate a child, whether you're going to deliver. So I think for me the key point is around messaging. But I don't want to lose an earlier point that was made by the CEC of Health in Mombasa. I think what they're doing in Mombasa is actually what should be done by all healthcare systems. You must plan and program to make the sub-county or the dispensary at the grassroots level to be accessible to everyone, not to be discriminatory. And by being accessible, you're not just saying you say it's free. You need to know, are people getting information? Can people physically access it? Do you have trained personnel that you pay well and are not on strike? Do they have protective equipment? And so some of the challenges we have is that when healthcare workers come out and say, we don't have enough personal protective equipment, me as a Kenyan or me as a person who needs to go to hospital will be like, okay, will I risk to go when the healthcare worker themselves are saying they don't have enough PEPs available to them? So we really need to get messaging that is clear, not just messaging and actual action on the ground that demonstrate indeed healthcare workers are protected, they've been trained well on handling COVID, and also when you go in to get other services, your risk of getting COVID is minimized or having interaction with that. So I think messaging and actually living through the messaging and not just a PR exercise of saying, we'll do this, we'll do that, but actually doing it and demonstrating to citizens that it's actually happening. Because if we do not change that attitude, if we do not address that fear that Kenyans have, as Eric rightfully said, you will see your rates of HIV going up, you will see more people having TB, you will see more maternal deaths, and this will be very disastrous to our healthcare system.
Okay, Angela, when you think about the challenges of going to hospital and of course the myths and misconceptions around COVID-19, how crucial is it to make use of the community health workers?
Thanks, Gladys. I think I'll take it first from where Alan has left. I think for me, if we are going to move forward, we should have a learning, we should be on a learning process. As I said earlier, the reason why we found ourselves where we are is because the response was, even the task forces, if we look at them, they were actually made up, they're made of epidemiologists, virologists, just close medical people, and so more close to the government. I think what we should learn and what we are learning from what we are hearing from the responses and from the communities, that we should have been more inclusive to realize that COVID response was not just going to be looked at from a medical perspective, but also from a wider societal approach, where you think of mental health specialists, where you think of people working in the education sector, you think of sociologists and other people, because the impact of COVID is much more than, it's beyond medical health. It's much more beyond health. It's more societal, it's more social. So looking at things from that perspective would have been an easier way of dealing with it. And I think we are not late. We should be able to embrace that. And what does that mean? People are able to go to the communities, including the community health volunteers, to collect information from the communities. What is going on? What are communities' experiences? What are the issues? What are the broader socioeconomic issues that need to be brought to the response? That way, we'll be able to respond much easier, including going to the local administration and understanding, do these people even understand the whole aspect of COVID, even how to take care of themselves? Because looking at how this response has been done, it's like, if you're in the local administration, you're not getting sick, you're not going to contract COVID and the like. The community health workers are an entry point, a start point of ensuring that whatever is in the communities, health-wise, is well addressed and is brought to the fore. So opening up the task forces, not to include just the high and the might in the government, but also the communities and the citizens themselves, because all of us are involved, should be involved. And we are the ones who are going to flatten this curve, if at all we are going to do it in the quickest point possible, if we involve each and every person in the society.
Okay, and speaking about flattening the curve, we have been told wash your hands, wear your mask, social distance. And I'd like to hear from Vitalis. Now that you're deaf and you need to, use your hands and also lip read a lot, how is that with people wearing masks?
That is a major challenge we have in the deaf community. Because remember, when I'm washing my hands, sometimes you need also to touch a person when you're communicating. So sometimes we live in a life with so much doubt, because sometimes you touch a person, you don't know whether this person is positive or not. And also the use of face mask, it's a big challenge for us deaf persons. When you enter a vehicle, or maybe you want to get home or you want to talk to your friend, the communication is not clear, because you have to, you must ask a person to remove the mask before you communicate. But now when you ask somebody to remove his or her own mask, the person will think like you want to spread the virus. Because sometimes I need to lip read. So sometimes the person will look at you, you're not using your mask. So why should I have a mask and I need to communicate? You see, the attitude of the society also, it's difficult to us. So I think the life of each person matters. So I think after Corona or COVID-19, persons with disability are woken up, because we've got the societal attitude. We have very high person getting into mental health problems. They're not only affected by the COVID, but you see, we have the different challenges economically and also medically. So there's a lot for us. We are most affected as persons with disability. Remember also, we have the caregivers to persons with disabilities, because some of them are on a medical condition and they use medication continuously. So now the life has become very difficult. So we'll think you'll continue to get support from the people who take good care of you, and sometimes they neglect you. So they've lost hope at the same time. So if we want to reduce the number of persons with disabilities, please, could you kindly change our attitude and how you perceive persons with disabilities?
Very well said, Videlis. And Andrew Molwa, I think that is a very critical point for those living with a disability. Your county has been lucky not to have any COVID-19 case this far, but are you catering for those living with disability at this time?
Thank you very much, Sarah. And we want to thank God and appreciate the people of Makueni and the people of Kenya for the efforts that they have done so far to flatten the COVID-19 curve. In Makueni County, rightly, as you have said, we have not had a confirmed case of COVID-19, despite several cases that we have, suspected cases that we have treated, and efforts at mass testing for vulnerable groups, especially people around Mombasa Road, and all of them have turned out to be negative. We have a massive plan in Makueni County, and I think that has really helped us in terms of creating awareness to all the members of public, realizing that Makueni is actually famous for its public participation model, which we, during this COVID time, decided to involve the community health workers to reach out to the public participation network. We were able to reach out to over 4,200 community health workers, train them, and also through the community health workers, reach out directly to 48,000 community or public participation network, which is the community development structures that we have in Makueni County. And each of these 48,000 was tasked to reach out to 5 households, which would eventually reach out to about 250,000 households in Makueni, an activity that has raised awareness in terms of what is COVID-19, because I personally feel we, in the first days, because this is a new disease and a lot had not been known about it, the approach was more of instilling fear to the population so that they know we have a dangerous disease, a disease that is has adverse effects on people, that is causing mortality, and people are expected to run and hide. But we realized that that approach may not be the best. It is equip people with information. And like you've mentioned, part of the 48,000 people that we are talking about are representatives from each of the 3,600 villages of people living with disability. So as part of our strategy is to first reach out to the communities, educate them, and them to educate others on COVID-19, how it is spread, how one can prevent themselves from getting the disease. And people living with disability are at the core of our effort. And I think as Makueni County, that effort alone has really helped us in terms of raising awareness of the community and the vigilance of the community.
Okay, Andrew, even as you say what you've been able to do on the ground, those community health workers, are some of them trained to cater for those living with disabilities? Do you have interpreters amongst them?
Yes, we do have, though we actually have a big challenge in terms of the numbers. The ones that are trained to reach out to people with disability, especially those who have hearing problems, are so few. Maybe in the 4,200, we are talking about 20 who are able to do sign language. And that is too little compared to the number of people that you are expected to reach out to. But in our health system, we have 6 sign interpreters who are part of our healthcare system and who are able to communicate. Like I said, part of our structures, essentially part of our community development structures, community engagement structures, we have people living with disabilities, representatives of the people living with disabilities, people who are actually living with disabilities. So they understand the challenges that people living with disabilities face, and we are able to inculcate their needs in our response.
You set aside a 12-bed capacity 2 months ago in readiness to cater for COVID-19 cases. Is that facility set up to cater for those living with disability?
I would say yes to because
you sound like you're struggling with that answer, Andrew.
I am struggling because we do not have a case as of now. But in terms of disability friendly, ensuring that there is access in terms of ramps, all those basics. But that does not mean, and I mentioned that within our healthcare system, we have trained personnel who are able to do sign language, especially. But I want to believe we are ready to handle people living with disability if we have them. I'm struggling because while we were setting up, we have the general principles of ensuring that you have ramps, you have all that, is what we have. But sometimes because during my practice, I've seen cases come to the hospital when I was in the clinical practice areas of people living with disability, people with hearing problems who need sign language, who use sign language, and we totally have no one to interpret what they are saying. I know that challenge is a real challenge in our sector. I would expect Makueni is not any different from the areas that I used to practice before I left.
Okay, all right. Now, elsewhere on a field in the town of Oban on the west coast of Scotland, a team of drone pilots had their eyes fixed on the sky above and adjacent hills. They work for a drone delivery company that is collaborating with the National Health Service to trial whether it is feasible for drones to fly medical supplies like COVID-19 tests and protective equipment to a hospital on the remote island of Muir, about 16 kilometers away.
This is the first time that medical deliveries have gone from one hospital to another. We're flying about 20 kilometres from Oban to the island of Mull. It's actually a project we've been working on for nearly 18 months now, building up the technology, making sure it's all working and testing, working with the Civil Aviation Authority. But as COVID came along, the need for the solution really accelerated.
This is a groundbreaking piece of work in the UK about the use of drones for NHS purposes. There's been lots of trials, obviously, in commercially, but this is about looking at how it can support NHS delivery, not only within Argyll and Bute remote isolated areas, but potentially into the urban areas where you have congestion and delays in traffic where you might need to transport. So within Argyll and Bute and potentially within the UK, we've got the very isolated communities. We have 23 inhabited islands. We have 7 community hospitals located across 2,500 square miles. So this is about improving the service that we can deliver to our communities and our patients by providing better patient care and quicker access to diagnostic facilities or for instance, some medical equipment that might be needed on the islands.
And innovation even as we deal with COVID-19. Now back home, to be precise, Kisumu County. Eric Okiomo, you are a community health advocate. Tell us how critical the role of community health volunteers is, especially during this pandemic.
Okay, thank you. Actually, what I can say that in Kisumu County, most likely in the community, are more likely to see more policemen in our communities, particularly the informal settlement, implementing a public health strategy than community health volunteers. So I think that's if you look at it, it looks more punitive. Just like I said previously, the issue of persecution, and you find that that has also created fear. Particularly people going to facilities that they'll be quarantined, because if you look at the quarantine is more of a setting whereby is manned by security officers, other than if the Ministry of Health could have taken a way such that people could even giving it a human face, bringing in the social workers and all those kind of things. Some of these things could work out easier, and the aspect of other actors within communities. And I think in particularly the informal settlement, it's very rare for us to see particularly the CHVs walking around, because those are the key people when it comes in terms of giving information, and could be probably because they take their time, and at times it can last several months before they are paid. So you realize that vulnerable communities in the informal settlement at times lack crucial information. So I think the situation is not as we can say that it's all good, but I think something needs to be done.
As a community health advocate, do you have the right protective gear even as you dispense your work?
Within my community, I've seen community health workers having masks once in a while, but at times they say what they have is not enough, and they actually fear now going about their businesses. So I think when it comes to the PPEs for community health, that is something that I'll say that it's not something that we are seeing, because we stay in the community and we interact with them and we talk to them, and they actually say that what they have is not enough.
Okay, now Alan, he has brought up a very crucial point. The community health workers are not remunerated enough for what they do, if at all. There is a bill before the House to ensure that this is done. How should this be done going forward?
I think the bill is long overdue. The need to recognize community health workers, although they call them community health volunteers, but they are actually the people who are critical to linking the communities to the health system, providing the right information, and being treatment support partners, especially for those who are taking lifelong medicine or medicine that has got difficult side effects. So it's my urge that both the Senate and the National Assembly have a sober conversation around putting in a clear legal framework that perhaps brings time forth to recognize both financially and in other aspects the work that community health volunteers have been doing, which sometimes has gone very unrecognized. And I'm pleased to hear from Dr. Andrew Mulwa, the CEC of Health Makueni County, that they actually have put in place a mechanism to ensure that they are working with community health care volunteers, because it's the person I see daily, like Eric, that I will trust if he comes and tells me you need to put your mask on, you need to wash your hands, rather than when I see it being beamed live from Afia House, I would relate more to the person who's closer to me. And this is something we have not done so well as a country, particularly for the national government, in terms of engaging the community healthcare workers at an early stage to be able to draw from the experiences of HIV, TB, or malaria, or any other aspect that is extremely important. So my call is that for the National Assembly, for the Senate, to soberly debate this and quickly pass that. And that's not only passing because we are renowned for passing good laws, passing good policies, and not implementing them, but at least Dr. Mulwa shows a different example in Makueni, but indeed if we do pass the bill and the bill is adopted, we quickly need to see how it can be implemented, how we can ensure who's gazetted as a healthcare volunteer, how they're enumerated, and how their work conditions are kept safe. And as we do so, we also need not forget the working conditions of those within the mainstream healthcare facilities, because challenges still remain with what we've seen with nurses, clinical officers, farm technologists. Those challenges need to be addressed. And as I said earlier, we really need to see how do we use the resources of COVID, both financial, both human resource, in a way to revamp the health system and to address all the inequalities we have been talking about and we have been seeing before. I think for me that will be the game changer in terms of going forward and making the silver lining out of the current COVID situation.
Okay, and we're about to take another short break, but before we do, let me look at more of your feedback, even as we try to understand what are the challenges you are experiencing, even as you try to get medical care, especially during this COVID-19 season. Some of them, we have Anthony Nganga, who says, good morning, NTV, joining the conversation from Nairobi. Access to healthcare remains a big challenge despite the clear constitution institutional provision. With COVID-19 and financial constraints, hospitals are finding it hard to sustain ordinary services. We shall overcome. Indeed, Anthony, a very crucial point there. Carol Jane, who says we need to embrace each other by following the rules laid down. Yes, that is very crucial in flattening the curve. Williams Mohazi, who says walking for long distances and poor service delivery by the medical workers. That has been alluded to by earlier speakers. Pragmatist says, access to adequate care, my needs are not met. I wish you could be more specific on which needs. Carls 001, who says, I fear being infected with COVID-19. Well, we have had many others who have been have alluded to the same, and the messaging of COVID-19 to bust the myths and misconceptions is very crucial at this time. A short break. When we come back, let's look at the status of water, sanitation, and hygiene. We'll be right back.
We care. For 26 years, we have been advocating for health rights with you and for you. We are determined to keep at it. Coronavirus is a global pandemic that poses significant threat to public health and tests the resilience of our health system. While implementing the public health and emergency measure, we encourage government to pay attention to human rights and principles around transparency, accountability, and respect to rule of law. We remain committed to working with government and other stakeholders in guaranteeing a rights-based response to COVID-19. Kellen, reclaiming rights, rebuilding lives. Basic protective measures as guided by the World Health Organization. Clean hands frequently with soap and clean water. Cover nose and mouth when coughing and sneezing with a tissue or flexed elbow. Avoid close contact 1 meter or 3 feet with anyone with cold or flu-like symptoms. If you have fever, cough and difficulty breathing, seek medical care early. Avoid raw or uncooked animal products. Help the world put an end to the spread of respiratory diseases by sharing this message with a friend. Message brought to you by Sour Herbal Family Bath Soap.
The Kenya Film Commission, in partnership with Techno Mobile, CDI Gadgets, Documentary and Reality TV, has rolled out the 3rd edition of the Mobile Phone Film Competition. It is a competition for short films shot using exclusively mobile phones.
To participate, you need to be a Kenyan citizen, have a smartphone that can shoot video in HD, be between the ages of 18 to 35 years old, shoot a film not longer than 5 minutes. The film should be in English, but if you must use any other language, please use subtitles in your film.
I know that every single one of you are all victims of Salvador del Mundo. Our mission is to get justice. It isn't easy to achieve justice. We will prepare for it, train hard for it, and we need to be very determined in order to succeed in our goals. It is not hatred that will fuel us, but our desire to stop the evilness of Salvador del Mundo.
I stand firm with my principles. I will not allow anyone to shatter all my hopes and dreams for our country.
Thank you for staying with Your World. My name is Gladys Gachanja. Now, our wife performs an at-home dental procedure on her husband with an online kit after Dominic Price, who required dental treatment 2 days after lockdown started, was told he would have to take matters literally into his own hands by his dentist.
2 days into the lockdown, and I was chewing on one of the children's sweets, which actually I'd never normally eat, but they were there. And suddenly felt a hard bit in my mouth, and I think I pretty instantly knew. So I rang the dentist on the off. I thought, well, they might have some sort of system running, but my suspicions were confirmed, and yeah, there's no way they can see anyone. At that point, there was no sort of backup at all, and they just said, you need to go onto Google. There's various kits available, and I sort of, part of me couldn't quite believe the dentist was saying that you need to, do your own dentistry, but this is the situation we're in. We've now got a sort of emergency hub set up, but they've said the emergency hub, all it does is extraction. So I'm in this sort of terrible situation of, if I go in, I'll lose the tooth. There's no sort of halfway measure with it, or I bear it and possibly get to see them in a month, and they may look at it and say it's absolutely fine, small filling. And
the thing with the kit is, it is easy to use, and it's not too scary or anything, but it does say on the back, go to your dentist within 48 hours of using this, and that's just not an option at the moment. So there's going to be a lot of 48 hours before we can go.
A situation most of us find ourselves in, even as we are told not to go to hospital, not unless it's absolutely necessary during this COVID-19. Now, elsewhere, the Europe director of the World Health Organization warns countries not to cut healthcare spending in the wake of the economic crisis ravaging Europe as a consequence of the new coronavirus.
At WHO, we are concerned that countries will respond to this crisis in the same way they did to the recession 10 years ago. Many countries in Europe responded to that crisis by cutting public spending on health. Today, our priority must be to invest in health, invest in social protection, and above all, avoid austerity, which has devastated the lives of so many in Europe.
Very critical message, even as we talk about the right to health. And now picture this. Everything is going well for you until you fall sick. Then the endless journeys to hospital begin. With no time, your insurance and savings are depleted. This is a reality for a number of Kenyans whose lives drastically change as a result of prohibitive health expenditures. Now NTV's Sharon Baranga gives us more details.
The past 5 years for Diana Wavua Mwalili have been dark. She has been crying, holding on to the hope that she will one day hear her daughter, Angel Rebecca Onyango, call her or run up and down in their neighborhood, Kayole Estate. Life for Wavua changed drastically when her daughter fell ill when she was 7 months old.
Nikampeleka kwa daktari. Vile nilivyompeleka hakumpima, akamwandikia tu dawa. Lakini nilivorudi naye kwa nyumba, zile dawa zilikuwa zinafanya kazi.
That marked Wavua's journey of desperation as she tried to find ways of ensuring her daughter gets proper medication.
Alipoenda kwa scan, alisemekana ubongo wake umeshikana na umeharibu hiyo uti wake wa mgongo, na wakaniambia maisha yake yote atakuwa anapatwa na conversion.
The condition in medical terms is known as bilateral frontal hypoxic ischemic encephalopathy, or HIE. It is a brain injury caused by oxygen deprivation to the brain, also commonly known as intrapartum asphyxia.
Ilikuja ikamsumbua kwa muda, ile ukulia sana usiku na mchana. Ikakuja baada ya miezi 6 ikaisha, lakini akabakia akiwa mlemavu.
In the process, her husband abandoned her after claiming that he had already used up more than 500,000 shillings. Wavua's story is similar to that of many Kenyans who struggle on a daily basis to raise funds for treatment.
According to Ministry of Health statistics published in 2016, catastrophic health expenditure drives an estimated 1 million Kenyans into poverty every year.
She used to operate a food eatery in Kayole that used to fetch her around 4,000 shillings a day.
Wakati sasa hiyo harakati ya kulala na mtoto hospitali ikawa na wacha wafanyikazi, wakawa wananiambia kazi haikuwa nzuri, hawajaweza kufanya kazi, chakula inaregeshwa, inaharibika, tunamwaga. Mpaka ikafikia nikafunga ile hoteli. Nikarudi nikaenda nikaweka kioski kidogo, lakini hali ya mtoto ikaanza kuwa mbaya zaidi. Ikabidi pia nifunge.
Wavua and Angel are currently housed by two young people aged 20 and 18 who came to their rescue after she could no longer afford rent. It is due to this that she could also not afford to pay for her National Hospital Insurance Fund since March last year. Dr. Vincent Okungu, a health economist, paints a grim picture of how grim the situation is.
The majority of the poor have little income to spare for non-food expenditure. In the event of illness, which is usually unplanned, they don't have any reserves. And even for richer households where we have long-term illness, they have the potential to also face catastrophic health spending and eventually fall into what we call the medical poverty trap.
Currently, 25% of the population in the country has health insurance cover. These are largely in the formal sector. The country is already piloting universal health coverage in Kisumu, Machakos, Nyeri and Isiolo counties. Under the program, some 3.2 million people will benefit from free healthcare services provided by the government. It is expected that once a national rollout is done, then it will alleviate the suffering Kenyans like Wavua are going through. Sharon Baranga, NTV.
Now, Vidalis, you come from Kibra, and I wonder, how is it? You said you've lost your source of income. A lot of those living with disability or those living in the informal settlements do not have a source of income. How do you access medical care at this time?
That's why initially I said it's a challenge to us, because most of us rely on caregivers. So with time, I think they will even give up on us. That's why we said depression is actually an issue in persons with disabilities. For example, when you start some small business, like most of us are not in formal employment. We do small business, we do hawking. But now during this pandemic, with a curfew, you have to close your business. So there's nothing you depend on. So we become dependent on other people and the poverty level goes down because most of us rely on relief food, which sometimes doesn't come by, or maybe our neighbors. So like the GCC, at the GCC, sometimes they get food to give to the community, but when they don't have food donation, then you'll just have to stay hungry. So if there's you're lucky, then you'll get the food. So with those with medical condition, and sometimes when you get an issue, you need to go to the health center. It becomes so difficult, so you decide to just stay in the house.
Okay, now Andrew Mulwa, we're talking about the right to health, and we cannot ignore that it comes with the right to have food on your table, a roof over your head, water, sanitation, hygiene. How are you catering for the vulnerable in Makueni?
First, I must appreciate the discussion on affordability of health to most Kenyans, especially at this time of COVID-19, where there has been disruption of livelihoods to a big extent, and most people cannot afford, like you just said, a simple meal because jobs have been lost, livelihood have been disrupted basically. To say, one, we are working very closely between ourselves and the national government as a county government through the County Emergency Response Committee, where we are undertaking all interventions that are aimed at social protection of the people together. We are using like the community structures that I had earlier mentioned to ensure that we are able to identify the vulnerable in the society, because you realize sometimes, a lot of times, when and our normal administrative structures are led to identify the vulnerable. They do not identify all the vulnerable people. They just identify some and leave others out. But with structures that go to every village, we are able to identify the vulnerable and prioritize who actually needs to be helped. And through this, working with the national government, we have been able to identify those who are able to receive aid in terms of food supplies, in terms of the social protection mechanisms that have had. This is in addition to the other programs, social protection programs for the vulnerable, people living with disability, the elderly, that continue. Our Makueni Care, which is our Makueni Universal Healthcare programs, comes in handy at this time, because even as citizens of Makueni seek health in our facilities, they are able to seek health without paying at the point of service delivery if they are members of the Makueni Care scheme, which 72% of the Makueni households already have registered. And that leaves 28%, which 18% already have national insurance. And therefore, the indigent population that we are talking about that is not covered by a form of insurance in Makueni is probably between 8 and 10%, which I would like to say, even as the country braces itself for rollout of national universal healthcare coverage scheme, I think this COVID-19 becomes an eye-opener for everyone in government, in private and public sector, to realize the importance of health insurance or health protection of citizens from catastrophic health expenditure. Because with the disruptions that have happened to the economy, with the disruptions that have happened to the livelihoods, it will be very difficult for any person today to say they can really afford their health from their pockets.
Thank you, Andrew. Now to Eric. Water, sanitation, hygiene is one of the first-line defenses to averting COVID-19. In this case, even before I get to your answer, 13 people so far died or have died due to a cholera outbreak in parts of the country, most notably the north, with over 500 people battling the illness, majority of whom are children. Now, with 12 of those deaths being listed as being in Marsabit County, and the county government insisting that it only has a record of 2 deaths, as they are only the ones that have been recorded in the health facilities. Now, at least 23 people had previously been imported to have died, or rather reported to have died, owing to the cholera outbreak in the neighboring town of Bubua, which is in Ethiopia. And on the ground, people say that those who tested positive in the one of the worst cholera outbreaks in Marsabit did not get immediate government attention. These are more so those in the remote villages of Ileret and Selicho, and at least 200 Kenyans were forced to seek treatment in Ethiopia despite cessation of movements in and out of the country. Now, Eric, even as we talk about water, sanitation and hygiene, we have the issue to do with this being a big hurdle in trying to keep away COVID-19. How does that look like in the informal settlement?
Yeah, okay, thank you. You'll realize that earlier that as I said, that we had floods in Kisumu, and basically, if you look at it, when you have floods, issues of sanitation and hygiene becomes a big problem, and accessing clean water is a big major problem. But you'll also realize that also the lake has. For example, the place I stay in, you'll find that we have people in camps and all those kind of places where basically services are interrupted. You'll again, when you look at the informal settlement, what we've seen is that different players have responded in those places. We've been seeing some water tankers by non-governmental organizations actually supporting, and I think is in collaboration with the county government, although you'll realize that it is important. It would be very much, it's important when the county government actually does that itself, because some of these people, for example, if they're not there, because that cannot be a sustainable solution by relying on non-governmental organizations providing essential services. And there are some places you'll still see that within the informal settlement, because of the economy and because people don't have money, you know, people, as much as the president said the other day about water being available in our informal settlement, you'll find that we have these standpipes where people have to buy water. And you'll realize because of purchasing power, and because you have to buy it from that person, and you cannot buy it, you see that one, you cannot negotiate. So I've seen kids maybe getting water from some holes. You find that at times there are some wells. At times you find that exposes them to diseases. And because again, you'll realize that now is compounded by the fact that people also don't go to hospitals. So we don't know who is sick now, who is not sick, and it's a very complicated issue that should really be looked at. And some of these things happen within our community settings, and you'll find that just like I had earlier said, our CHVs, people are implementing the public health strategy, and more you see policemen going after people about masks and everything. But now, if you have the CHV and other people, probably there's one or two things they could be doing in relation to that, giving information why people should not take water and all those kind of things. So it is a problem. Thank you.
All right. Now, Angela, how imperative is water and sanitation when it comes to maternal health and, of course, menstruation hygiene?
Thank you, Gladys. I mean, everybody knows that without proper water, sanitation, and hygiene, we cannot be talking about quality healthcare. And let me paint a picture. Last year, even before COVID, we undertook a survey across the country where we collected 120,000 responses from women and girls, basically to ask them, what does quality healthcare mean to you? Because a lot of time we hear people talking about quality healthcare, but who interprets quality healthcare? Is it me, the giver of the healthcare, or is the receiver, the recipient of the healthcare? And it was very shocking and to know that water, sanitation, and hygiene topped the list of what quality healthcare means to women and girls. What does that mean? For them, women and girls feel like when they go for maternity or when they go for maternity health services, they want to find clean toilets, clean linen, clean floors, clean sinks, and so on and so forth. And so for them, that is what quality healthcare means to them. Two, girls, when we talk to girls, adolescent girls and young people, they told us that water and sanitation for them means having to have running water when they are menstruating, such that they are able to be able to wash themselves. If they are using disposable pads, for example, they are able to wash them without feeling any shame or any shyness or without lacking these things. Now, let's talk now about the COVID response. We have seen that washing hands has become, it's mandatory. And that should have been the norm even before COVID, because primary healthcare dictates that prevention and promotion, water and sanitation should be the cornerstone of any healthcare. So for me, water and sanitation and hygiene should be the driving force of any healthcare. You cannot talk about having health facilities in the country spread across everywhere if they have no running water, if the sinks are not working, if the toilets are dirty, if the incinerators are not working, and so on, and the linen is dirty. So for me, if water and sanitation and hygiene is lacking, then you should close health facilities and tell us where next do we need to go to seek health facilities. And that brings me to the point that I talked earlier about involving all sectors in healthcare. Health is not just an issue of only the Ministry of Health or the county health departments. It is every sector, because water is outside the health sector. But water sanitation is an imperative. It's important that we have that in the health facilities. So for me, for health to be realized in this country, and even beyond COVID, the universal health coverage, we should have water, sanitation, and hygiene as a cornerstone for it to really make the difference and ensure that women and girls and other people and citizens in general stop dying in general.
Very well said. Even as we wrap up this conversation, Alan, what are some of the lessons we can borrow from previous pandemics or now the endemics we have to live with, even as we pursue the right to health?
This has been a very good conversation, Gladys, with very well-informed panelists presenting exactly what is happening on the ground. Three things stand out for me. learning from the HIV pandemic, learning from other issues such as Ebola. First, we must not criminalize a public health response. For now, the weakest link is the police force, and I use the word police force deliberately because they call themselves police service, but if they need to live to the word police service, they actually need to change. What we see happening to healthcare workers, to journalists, to Charles, who had all the permits that required him to bury his wife who had died of cancer, is actually heartbreaking. So we need the Inspector General of Police to rein in on his errant police officers because they are the weakest link in this pandemic. So the first lesson is do not turn a public health approach to a criminal one. And for the Ministry of Health, they need to take back their public health role. They have abdicated this duty to the police, and that is becoming problematic. It's affecting their mass testing, it's affecting people wanting to know their status, and that is actually problematic. Thirdly, we need to speak to the reality of these social determinants of health: water, food, housing, sanitation. These actually must come into play. It's time for us to get this right, working both as civil society, technical partners, national government, and county governments. And as Kellyn, because our strength is on health and human rights, the best we can offer the public is to say, if your right is violated, please reach out to us. We are happy to help. In fact, this morning we are going to court to challenge the issue of mandatory quarantine and how it was rolled out. But we do not want to get to a stage where we are going to court. So let the national government, let the county governments do what is right. And as I challenge the CEC of Health in Mombasa, it's a challenge to all CECs, including our good friend Dr. Mulwa. When COVID is done, would counties and the national government be open to an audit by different stakeholders around how are they meeting these essential elements of the right to health? That would be my parting shot, and thank you for having us here today.
Excellent. Thank you for that. Alan Maleche, Executive Director at Kellyn, Angela Ngoko, who is Executive Director, White Ribbon Alliance Kenya, Eric Okioma, who is a community health advocate in Kisumu, Videlis Njoki, who is deaf and was representing those living with disabilities, Flora Atieno for being our sign language interpreter this morning, Andrew Mulwa, who is the CEC for Health in Makueni, and of course earlier we were joined by Hazel Koitabo, who is the CEC in charge of health in Mombasa County. Thank you all for joining us on this very crucial conversation on the right to health. Now, tomorrow we focus on water, health and sanitation in the region and the impact of the lack of it, considering water is one of the frontline measures in the fight against COVID-19, as you've heard from all the panelists here. So see you tomorrow and be part of this conversation. My name is Gladys Gachanja. Have a good day.
I help women find independence by training them in fish farming. It's tough on my back, joints, and can cause headaches. Panadol Extra relieves multiple types of pain. If symptoms persist, seek medical advice.
This lady is a super achiever, sits on many boards, a proud mom and a force to reckon with.
I was those kids, what do you want to become? A neurosurgeon. Why? I want to open her brain, to fix whatever was broken in there.
Dr. Stella Bosire.
I spent a better part of my childhood in the streets as a chokora. I even had to sell drugs to keep my family afloat. When I hear a man has beaten a woman, those moments take me back deep into those dark moments growing up. I saw my mom being beaten. We buried my mom without teeth. I can't be angry. I can only forgive.
Unscripted with Grace, Saturday, 8 p.m.
To achieve great things in life, you must do little things every day, like the 1, 2, 3 with Colgate.